welcome. 46 people died of an accidental overdose in San Francisco last month. This is approximately 22% fewer deaths during the same month in 2023. And to date, overdoses in San Francisco are down about 20% this year compared to this time in 2023. We believe this decrease can be partly attributed to the gains we have seen in new clients starting medications for opioid use disorder and in our other treatment programs. This includes a 54% decrease in buprenorphine prescriptions filled by the department since January of 2023, and a 34% increase in patients accessing methadone in the city in 2024 to date compared to 2023. We've also seen a 35% increase in residential treatment for substance use from last year, and a 50% reduction in median time to admission for residential treatment. Most overdose deaths in San Francisco and nationwide continue to be driven by fentanyl. These deaths are preventable through addiction treatment, which is accessible through the DPH system of care. Just to emphasize, these are life-saving medications that reduce the risk of death from overdose by as much as 50%. That is why in this era of fentanyl, we have been focused on getting more people into drug treatment and on the road to recovery. This means getting people off the streets and into treatment. We've done this by expanding access to medications such as buprenorphine and methadone through our buprenorphine on demand 16 hours a day, 7 days a week program, providing people with buprenorphine and a bed, which is a program that gets unhoused people on the street a place to stay while starting buprenorphine and other life-saving treatment. We've been embracing and expanding innovative treatments such as contingency management and injectable buprenorphine, which you'll hear about a little bit later. Expanding hours at existing programs and launching new treatment programs such as contingency management therapy for stimulant use disorder. We continue to strengthen our case management and patient navigation to make sure that people get the care and treatment they need wherever they are. We know that everyone's path to recovery is unique and that different treatments work for different individuals. For people with opioid use disorder, medication treatment that helps reduce cravings, such as buprenorphine or methadone, is an essential tool in the recovery process. But many of these medications typically require patients to take multiple doses a day, or in the case of methadone, make daily visits to a clinic for supervised administration. That is why injectable buprenorphine can be a game changer for some people. That is why injectable buprenorphine is an innovative treatment that we're expanding at DPH. You know, I see patients at our HIV clinic at San Francisco General Hospital, part of the Department of Public Health. And one of the things that I've seen is how, for some people, getting an injectable HIV med, these are meds that are also relatively new on the right in our toolbox. How injectable HIV meds can really help people who otherwise have trouble adhering to daily medication become healthy. Injectable buprenorphine has that potential for people. Given once a month as an injection, it provides people the stability and flexibility that may be needed as they recover. No one should recover alone. That is why we're here to help them and get people into treatment that works for them, off the streets and into treatment. And I'd like to welcome Dr. Hillary Kunins, our Director of Behavioral Health Services and Mental Health SF, to share more on how our innovative approach to injectable buprenorphine is being used to reduce overdoses and help people get and stay in treatment. Thank you.
Good morning. Thank you, Dr. Colfax. As you just heard, we have effective treatment options for people addicted to fentanyl and other opioids, and we want the public to know this. The most effective medications, as you just heard, are methadone and buprenorphine, both of which mitigate the risk of death by about 50%. As you heard, injectable buprenorphine is a relatively new medication, a relatively new formulation of the medication buprenorphine that is another tool to help people recover from opioid use disorder. Like other injectable medications, whether HIV or diabetes, an injectable medication can be ideal for some patients who don't want to take a pill every day or face other barriers to taking a daily medication. And we're fortunate that long-acting injectable buprenorphine is now an option for people who use fentanyl, including people who might be experiencing homelessness. The once-a-month injection provides flexibility while still helping a person reduce cravings and other effects of opioids. Injectable medications can reduce barriers to treatment, such as housing instability, creates for our patients who might be experiencing other challenges like insurance issues, transportation issues, or find that their medication is lost or stolen. Taking a monthly shot of this life-saving medication can give people the time and space to recover without the burden of a daily medication. While fentanyl has made it more challenging to start buprenorphine, one can require several days without using illicit substances or slowly increasing buprenorphine. A new option with this injectable formulation of buprenorphine can provide additional option for starting treatment that might make it easier and more quick. Across the DPH system, the use of long-acting injectable buprenorphine is expanding. And from January through November of this year, there have been more than 1,700 patients who have received buprenorphine, all kinds, through our behavioral health pharmacy. Of these, about 200, or about 13%, have opted for injectable buprenorphine. And that is nearly twice the number of people treated with the injectable buprenorphine in 2023. As we head into 2025, DPH will continue to increase treatment options for people with opioid use disorder and other substance use disorder, whether it's injectable buprenorphine, the oral form of buprenorphine, methadone, other medication treatment, contingency management, or residential treatment. We want to increase availability and accessibility and embrace new, innovative, and medically effective treatments as they become available. We urge anyone who needs help or have a loved one who needs help to come to one of our sites or call DPH at 888-246-3333 to connect to a treatment regimen that best suits their needs. Thank you very much.